Dr. Bara Pankania joins us now from Bath here in England. He's a senior clinical lecturer at the University of Exeter's Medical School. Doctor, always a pleasure to have your expertise. You as a member of the scientific community, many of your colleagues are often at odds with the government's advice. What do you feel about the effectiveness of vaccines and especially the booster in terms of trying to mitigate the very worst effects of Omicron here in the UK?
So the vaccines are a great discovery, and they certainly prevent and protect from severe illness, and they certainly reduce the fatalities from a SARS-CoV-2 infection. And the booster, the idea of the booster is that it increases the quantity of antibodies in circulation, as well as the range of antibodies that are present, so that it works against Delta as well as against Omicron. Having said all that, infection control is never a binary choice, boosters or nothing. It has to be boosters as well as other things. And Prime Minister Johnson must include things like wear your masks, reduce your gatherings, cancel the gatherings, have the ventilation in the schools. And one thing that the United Kingdom is out of kilter with the rest of the world is, what I mean by that is Europe, United States, Canada, is we are not fully immunizing 5-year-old children and above. We should be considering that, because that too suppresses infections.
Yeah, OK, so you mentioned quite a few things there. And let's remember that Boris Johnson's government only makes health decisions for England. The devolved nations, Scotland, Northern Ireland, Wales, they do their own. And you hit on, I think, what's a very, very important point. Sure, there are more mask mandates in more public spaces, but the advice from the government for England is it's coming up to Christmas, go to your Christmas parties. That sounds counterintuitive.
It is so counterintuitive and frustrating and depressing in equal measures, because the virus doesn't observe such artificial boundaries. And really, if we are serious about it, I have been advising that we all wear better specification masks, FFP2 masks, and we wear them in all places where we have human-to-human interactions. I know that our government finds it very difficult to mandate mask wearings in those circumstances.
It's quite incredible that the Health Secretary should say that we're at a level and rate of infection that the UK has not seen before, considering the UK suffered some of the worst effects of the Delta variant anywhere in the world. So in a way, it's almost playing catch-up because of the success of those first and second doses. The UK is still playing catch-up. That's what I mean about it being quite incredible. How much do you think, and you mentioned it earlier again, is it due to school children between the ages of 5 and 11 not being vaccinated? Because in the EU, they've certainly approved vaccines for that age group, and they've been doing it for quite a few months in the United States. How critical is that?
It is very critical, and it's very important, and we've sort of lost the wood for the trees, because whilst the narrative may be that children do not suffer from serious infections, the point is children do get infected, some of them become very seriously ill, some die. Also, children get infected and bring their infections to their parents, grandparents, and so on. So children are responsible for propagating infections to older age groups. And one way around it, we should have done this many, many months ago, is to suppress infections in schools by immunizing them.
Later this week, Parliament is going to vote on whether vaccine passports should be introduced, and they're working successfully across many European countries. And it looks as if politics is going to become important here. Clearly, I don't need you to make an assessment about the political situation, but when it comes to decisions like this, politics and the lawmakers, they have their own assessments to make. And many of them don't want to introduce those vaccine passports. They don't want another long lockdown. They don't even want a 10-day, for example, circuit breaker because of the effects on the economy. I mean, you can see the issue there that politicians face, right?
I do, and my simple advice to politicians is don't blame health for everything. If you sort out health, the economy gets sorted out simultaneously. And with respect to passports, if I may say, it is a very symbolic gesture, because if you have a pass which says I am fully immunized, you gain entry to many places. But we must also remember that you can be fully immunized and be infectious as well. And therefore, that caution of, yes, you're fully immunized, but are you truly not infectious as well, also needs to be addressed at the same time. Otherwise, what we're doing is falsely dropping our guard because we've got a piece of paper which says, I'm fully immunized.
Yeah, absolutely. And I'm going to have to leave you there, Dr. Pankania, but it's worth adding just onto your last comment there that it's already been proven that the Omicron variant is breaking through into people who have already had the 2 shots of any vaccine. Dr. Pankania, thank you so much indeed. Take care. Have a good evening.